May 11th. Fibroid in women who desire fertility is typically treated with myomectomy. Postpartum wound infection occurs 4 to 7 days after delivery. This postpartum wound infection typically occurs after a C-sectional delivery. From the incision, uterine artery embolization is only used in postmenopausal women who do not desire fertility. Premenopausal. Poor outcomes of oligohydramnios power sequence, which causes oligohydramnios. Thinning of the cervix during labor is called effacement. Immunocompromised individuals should get a pap smear done every year until 3 normal pap years, and do it every 3 years. And this test is used to diagnose endometriosis. It's a sliding sign test. Uterine involutions can cause late postpartum bleeding. Current late variable decelerations are fetal heart rates in the category 3 pattern. Next best step in management of a pregnant patient with findings of AEDV or REDV in umbilical artery Doppler. Immediate delivery. Diagnosis of fetal hemorrhage is done by the Key-Shower test, KH test, Key-Hour bed key test. Bishop score includes fetal station, cervical dilation, enlargement, dilation, effacement, position, consistency. Risk factors for birth trauma include difficult deliveries, first-line tocolytic for preterm labors, indomethacin. Steroid group drugs inhibit uterine contraction. Next best step in the management of a pregnant woman who has an active toxoplasmosis infection. Next best step in management of a pregnant woman who has an active permethrin, sulfasalazine, and leucocorin. Risk factors for breech presentation includes limited fetal movement or excessive fetal movement. One cause of second stage of labor arrest is fetal malposition. Most common fetal malposition is the occipital posterior positioning. Pelvic inflammatory disease is usually treated outpatient. What is the management of a pregnant patient with positive antibody below 20 weeks? Doesn't affect the mom, so reassurance and support. To decrease the risk of Zika infection, you want to avoid traveling to endemic areas. And you can diagnose pneumochlamydia infections by PCR or NAT of conjunctival or nasopharyngeal swabs. Urinary embolization is used only in premenopausal women who do not desire fertility. Cardinal movements include descent, extension. Poor outcomes of hydramnios is the cord compression. Medical treatment of fibroids includes COCPs, progestin, OVN, IUDs. Measure the shoulders, totia, summarized with mnemonic B calm, where L stands for enlarge the vaginal opening. Poor outcomes includes meconium aspiration. Lichen planus often presents with reticular white lines, first known as Warkham's striae, especially on mucosa. The first pharmacological treatment for menstrual irregularity due to polycystic ovarian syndrome is contraceptives. Tamponic therapy for hospitalized patients with pelvic inflammatory disease includes IV Cefepime, cefoxime, cefoxetine. Patient in preterm labor under 37 weeks should receive corticosteroids to reduce risk of neonatal and reduce stress syndrome. Most recommended treatment for endometrial carcinoma. Hysterectomy. As well as having children who feel born to carry an unaffected father. 25% chance of passing on that all contraceptives are associated with a hypercoagulable state. Most likely determined gestational age that you do in fact transvaginal or ultrasound at the first trimester. Coronal measurements. You're looking for gas species and vaginal culture due to 36 to 7 weeks. Combined estrogen progesterone therapy for vasomotor post-menopausal symptom increases the risk endometrial breast cancer. Aromatase efficiency is associated with what kind of ovaries on ultrasound due to high concentration of gonadotropins. Polycystic. Corticosteroids are expected management. Was like this is an afebrile middle-aged person holding allowed breast warmth, so erythema and swelling refractory to antibiotics. A febrile middle-aged woman that presents with breast warmth, erythema and swelling. Inflammatory breast cancer because she's afebrile. Can a woman with chronic Hep C infection breastfeed? Yes, as long as they don't bleed. Labor intervention in the country indicate after classical cesarean or extensive uterine surgery. Common cause of acute cervicitis is Neisseria gonorrhea and chlamydia. The pathogenesis of hypogonadotropic hypogonadism include loss of pulsatile GnRH secretion. Under 3 or 4 weeks from signs of action, fetal compromise. This is the delivery magnesium corticosteroids antibiotics. Recurrent vulvovaginal canalization warnings evaluation for underlying diabetes mellitus. Next best management after IV lines been placed in a woman with uterine inversion with a retained placenta. I want to do a manual replacement of the uterus. Management of pregnant women that is rubella and non-immune, giving the MMR vaccine postpartum. HELLP syndrome has triad symptoms that include high elevated liver enzymes, low platelets, hemolysis. Alzheimer's disease is a sign of congenital syphilis. Management for pregnant women at 35 weeks gestation versus a preterm labor and the breech presentation warrants a C-section. As a complication of prolonged rupture membrane causes chorioamnionitis and endometritis. First line hypertensives is hydralazine, alpha-methylopa, labetalol, amphetamine. Hydralazines, moms love amphetamine. Labor and vaginal conjugated after a preterm. Classical. Oral carcinoma is a tumor with early magistrate, especially to the lungs. Patient with intraamniotic is intraamniotic infection, delivering and repeating body. As we measure for with labor. require STI screening in the third trimester. Stolylated cell tumors produce androgen causing rapid onset. Hirsutism masculinization. Remember that toxoplasmosis infection was given to newborn at birth. Uterine rupture classifies women with a prior C-section, surgery, also preeclampsia. First trimesters of high risk requires screening for STIs at high risk. For trichomonas injection, you want to give them oral fluconazole, metronidazole. Fluconazoles for Candida. Oligohydramnion is characterized by amniotic fluid less than 6 centimeters single deepest pocket less than 2. Frequent vaginal douching to contain salivated is a subgroup of risk factors for bacterial vaginitis because the soap will kill natural vaginal microflora. Treatment of pregnant mother with primary secondary syphilis. 1 dose of penicillin G IM. Asymptomatic Bartholin dust allowed to drain spontaneously and heal spontaneously. Or drug can be given as a complete spontaneous abortion to decrease infection risk. After a complete spontaneous abortion to decrease methylanologonavine for an abortion. The version is contrary with low amniotic fluid. XL versions when repression. Endometritis is transabdominal ultrasound. No. Also treatment for newborn gonorrhea infection. Tetraxel. IVIM. Menopausal women with laser moisture contributions and hormonal, but there's strong hormonal moistness. So this is our eyes. Risk factor for intrauterine fetal demise is fetal maternal hemorrhage. Living patient, slow swivel dilation, normal labor. It's actually a disease. Most recommended treatment for Candida vaginitis is oral fluconazole. Fetal anemia in a pregnant mother with parvovirus infection. Measured by UFD. Treated fetal demise before. 20 feet by dilation and evacuation. This was in premenopausal women with complexes on TV biopsy. Twin pregnancy not delivered at 36 or 7 weeks. At time of menses. Let's recommend management of a pregnant patient with history of preterm labor and or cervix. Coronal feature movements of fetus, engagement, flexion, descent, expulsion. Antibiotic therapy for inflammatory anxiety, cefoxetine, cefoxitin plus oral doxycycline. Subchorionic hemorrhages cause that resolves. Treatment for severe cases of transfusion syndrome. Fetal laser coagulation. Alright, bloody nipple discharge. Instructal papilloma. Radioinduction labor. Bishop must be greater than 6. Dilated face cervix on physical exam is diagnostic of what? A dilated and face cervix on physical exam is diagnostic of a breastfeeding woman with acute mastocytosis. Placentotide trophoblastic tumors usually occur after a blank. I'm going to give her the immune globulin at 26 and 7 weeks gestation within 72 hours of postpartum. Applying malnutrition risk factors for preterm birth. Most common side effects for oral contraceptives. Most common side effects of oral contraceptives is with delivery, a pregnant patient who's pregnant with twins. They're both vertex vaginal delivery. Next step management patient at 34 weeks gestation percent decreased fetal movement by fetal contractions. Recurrent to variable and late deceleration or placement carrier through pattern. This is a fetal tracing of uterine tachocystole, intermittent variable deceleration. There's external cephalic version, includes an record Russian uterine bleeding. Sure. Cardinal movements include engagement. Downstream prevents with increased HCG and inhibin A. Markers are high up. The ones that have H in them are increased. Or Chinese are ripen, mesoprostol, and conjugation of external cephalic versions are the same as C-section, which is a previous C-section. Placenta previa, as well as myomectomy. Vaginal lesion, genital tract lesions. Risk factors urinatony are prolonged labor. Urinatony is failure of uterus to contract. Management of category 3 fetal heart rate pattern. Operative delivery. Uterine inversions due to excess uterine cord traction. Sertolated horse produces androgens. Next line in management of patient refuses preterm labor, shorter cervix, and progesterone cervical. Urinatony is blockage of uterine contraction, so fibromyxin sulfates. Was mentioned pregnant patient with positive antibody testing for parvoger in 20 weeks. The mini pill is composed of etonogestrel, norethindrone. Poor outcomes of gyneco's is placental insufficiency. Measuring of intrauterine fetal demise. Right below is an IUPC training. This is even tackles this thrombocytopenia presents with gestational thrombocytopenia. Nothing. A progestin implant contains etonogastro. Cervical trauma during the course is the cause of first vaginal bleeding results. The historical clues for differentiating secondary descent from primary abnormal uterine contraction. Mentioned birth trauma is main repair and surgical repair. Measured severe features of PID should be evaluated with transvaginal ultrasound. Before there can open for incomplete pelvic organ prolapse. Orchestritis. Second-line tocolytic. Nifedipine. Pregnant number with tertiary syphilis, you give 3 doses of penicillin. GIM. Uterine fibroids. And cause size state discriminates during pregnancy. Severe cases of polyhydramnios includes amnio reduction and what kind of medication. Amnio methods. No method. Secondly, management of recurrent verbal deceleration is transcervical. Amniophage. What's a pharmacological treatment for newborn from a mother with a CMV infection? Cyclovir, valcyclovir. Positive bladder stress test. Stress incontinence. No treatment for pregnant woman who tested positive for chlamydia. Or azithromycin. Measurement for patient with short cervix on TVUS. No history. Expect management. Using progesterone. Patient presents 1 fever, 1 week after delivery. Sage grade 25. Treatment option for severe cases of polyhydramnios. Reduction. In addition to masturbation, chemotherapy is for trophoblastic neoplasm. Telmethacin. Depo-Provera contains methylprogesterone. Non-midline pain is a sign for secondary dysmenorrhea. This is abnormal menstrual bleeding. What are cardinal movements? Flexion, extension, descent. Responsive to antibiotics is treated with image guided drainage. Uterine artery embolization can be used to treat bleeding, bulk symptoms, and fibroids. You can rapidly serve with manual dilation. Primary abnormal poison is oligohydramnios. Rare complication of IUDs is uterine rare complication of IUDs is uterine perforation. These are clues for individuals who don't pay after menses. When primary symptoms getting worse over time, the most delivery, both vertex and non-vertex, is cesarean section. So depression primarily dyspareunia, which is pain during sex. Major movement and major about atypia. Trying to expect management first. E2 gel. It's driving cervix management is manual. So interesting secondary dismitter. Medical treatment option properties was CPs, LND, Ds, GnRH agonists, progestin. Patient with severe features of PIDGE would TVS exclude 2 ovarian abscess. What is management with atypia? Endometrial hyperplasia with atypia. Hysterectomy. Management after biopsy. Let's measure endometrial proliferation. Placental cytoplasmic tumor. Mild to unexpected management. As part of treatment for conducted by a neonate with mother had chlamydia. Oral azithromycin. Erythro. So there are no signs of yield compromise. Mr. Regularly do PCOS OCPs. And is only used in premenopausal women who offer their fertility. An estimated gestational age measure the uterus via ultrasound do crown rump measuring. Increased risk for breast cancer. Recommended management for a pregnant woman at 28 weeks gestation prevents in labor for a fetus diagnosed with anhydramnios and encephalooperative deliveries. Visually polycystic because they're getting more estrogen, so more ovaries. Polycystic labor and vaginal delivery conjugated after a classical cesarean section or myectomy. Trichomonias is treated with Metroni dissolve for them, both couples, treatment for threatened abortion. Treatment for not complete spontaneous decrease infection risk. This will look at what is the treatment for fetal anemia? You have red blood cells into urine nervous transfusion. Laboring pressure with slow cervical dilation is called protraction of active labor. Mention of IUDs before 24 weeks. This by evacuation dilation. Severe twin-to-twin transfusion syndrome. Laser coagulation. Fetal sexual actually occurs after a abortion pregnancy. Next step management. Decrease fetal movement of physical profile testing, stress testing. Cell aggressions, uterine rupture. Most common side effect of combined OCPs is breakthrough bleeding. Operant delivery for category 3, fetal bradycardia. Recommended management, preterm light, normal cervix on TV, US. Progesterone 0, 24. And variable decelerations. Engagement. Next line management, history, preterm labor, short cervix, progesterone cervical circlage. Progesterone pills, most common side effect is uterine bleeding. What's management of pregnant patient with positive antibody testing for parvo greater than 20 weeks? Weekly ultrasounds looking for hydroxyl vitalis. Mini pill is norethindrone. Treatment of severe cases of polyhydramnios can give indomethacin. Bleeding is a historical clue for differentiating secondary from primary. Two ovarian abscess is treated with image-guided drainage.